There are many causes for knee pain, but as you get older and older, osteoarthritis of the knee is the leading cause for knee pain. And the treatment options outside of getting a knee replacement are limited. There are joint injections, and then there are some nerve treatments. But ultimately, there are not a lot of options for people that have severe pain from their osteoarthritis of the knee. What we know about the knee arthritis is that part of the pain is due to inflammation, and that's where genicular artery embolization has become an emerging effective technique for pain management. Genicular artery embolization is an outpatient treatment for osteoarthritic knee pain. It specifically works on the inflammatory component of the pain. It is a procedure that, like many other embolizations, is done through a small hole in the artery. At Summit Interventional Radiology, we do this as an outpatient procedure. You'll come to our clinic, have an IV started, see our anesthetist, and then roll back into the procedure room. We use X-ray guidance to place our catheter, which is like a small IV, through an artery and into the small arteries that are around the knee. And the genicular artery embolization process is where we drip these small soft plastic beads into the arteries that are specifically feeding the inflammation in the knee. And we can see this when we inject dye under X-ray guidance or fluoroscopy. And we slowly drip in a very small amount of beads, not enough to block the blood flow, but just enough to slow down the blood in the arteries that are feeding the inflamed portions of the knee joint. And after we've accomplished that, we'll pull our catheter out and put a small closure device or a plug where we went into the artery, and then we'll wheel you back into your recovery room, and you'll lay back and let the artery heal for about an hour, and then we'll get you up and walk you around, make sure you're feeling okay after the anesthesia, give you any medicines if you're experiencing any pain or nausea, and then you'll be able to go home. Afterwards, patients will experience some pain in their knee, usually in the areas that we do the embolization. They can often see a little bit of a lattice-like discoloration of their skin in the areas that we targeted of the knee joint, but that'll all resolve. And then as 1 month comes around after your treatment, and then even more so at 3 months or 6 months, the pain that you experience in your knee will begin to go down. And generally speaking, we track this using a scale that is used for orthopedic procedures, and then just a plain pain scale. And in most patients, we can bring down your symptoms by 50% or more.